Hi guys, this is John Genet with ByoNetics. It is the 14th of May, 2014 here in the Florida Keys. I got an interesting email last night. It was from a lady by the name of Lisa. Lisa was concerned about my legitimacy because of my background in these videos were my kitchen and a picture of my daughter's rendering on the wall of what she thought a dad should look at it when she was about 11 or 12. And uh, there's a lot of people who will only uh, believe that legitimacy comes from a particular look as far as an office is concerned, wearing a white coat, having a bunch of letters after your name. My experience in my family was that the more letters behind the name, the more that we paid for the particular service they were offering, and the result was negligible at best. Right? Uh, if you have an illness, the first thing that you want to do is to find somebody who has survived that illness and find out how they did it. Do you want to seek medical help? Of course. Do you want to have second opinions? Of course you do. Right. But when it comes to when it comes to autism, the problem is that there's very few experts that are out there. Right. They are they're usually child psychologists that put therapies together. 99.9% of all the therapists that you go to, whether it's a doctor, a practitioner, whatever their designation and rank is, have never come home to an autistic child. They have no idea what that home reality is like, and they've never been autistic like your child or I have. So they write these therapies that will only work in a proper reality. Well, for your child to benefit from that expensive therapy, that child has to function in a proper reality and connect to its software so that software can instruct the brain on how to use that therapy and to benefit from it in developing speech, emotional contact, mental focus, stuff like that. Right? I'm unique in the respect that I'm, if not the oldest, I'm one of the oldest uh, members of the autistic community. I'm also one of the first children to ever be defined with autism in the United States back in the 40s. A lot of what we understand now about autism because of my parents' experience with my autism. Right? I come to autism with a unique voice because I'm one of the few that have experienced it and can communicate uh, what it's like to be autistic, what has been done to address autism, what has worked and what has not worked as far as addressing autism is concerned. And a lot of the times, the majority of the times, I'm probably most beneficial in letting parents understand what their child is going through because nobody can really discuss that unless they've experienced it. They can see it from the outside, but it's nothing of what's happening on the inside of that child, right? So, with that knowledge, uh, and with a lot of good luck, were we able to develop ByoNetics. We're measured by our results. We're not measured by our grant money. We're not measured by the ability of the insurance company to pay for things. Uh, in the medical profession, a patient is looked at as an income generator. Uh, they know what that patient will generate as far as income is concerned by having a particular disorder, especially autism. Um, they um, they know, excuse me, they know the kind of medications uh, to prescribe because it's presented by the pharmaceutical company that helped uh, finance their education. A doctor comes out of medical school now with close to $300,000 in loans. They get out of medical school, the pharmaceutical company says, we will restructure that loan for you in an interest rate that's very favorable to you. We will provide you with enough money to set up your practice, right? And we will provide you with our computer software to help you manage that practice and to be of benefit to your patients or clients. So doctors, of course, take this new financing, take on a partner as far as the pharmaceutical company is concerned. And nowadays, when you, like if I take my daughter into a pediatrician that's been with her all of her life, she's now 21 years old, so she goes to a different doctor. But when she was a child, the doctor doesn't come in and ask what's happening. It's an associate that comes in, usually some type of an assistant or a nurse. She asks what the symptoms are. She writes them down. She leaves. She goes over to the computer. She puts in the symptoms. The computer gives her information on what those symptoms would relate to as far as disorders is concerned, what drugs they provide to address that, and then that's given over to the doctor. The doctor comes in with his stethoscope around his neck. He says that we believe this is probably what it is. I'm going to write you a script for this. And that's the transaction. That's what makes that patient an income generator. Right? And it's not the doctor's fault, but the doctor has the information that's on that computer that's provided by that pharmaceutical company, especially as it relates to vaccinations, to different psychotropic drugs that are used to manage hyperactivity, depression, stuff like that. And they are coming in with good faith. I'm not going to discount the role of a doctor. That's not my position to go do. However, right, a person who grew up autistic and probably experienced all the symptoms that your child is going through, I probably experienced them before anybody did, because I'm almost 70 years old, right? I have a position of authority in this because I'm one of the oldest members of the autistic community that conquered autism. I would be one of the first people that you would want to talk to as far as your child's autism is concerned, because I've successfully repaired the damage of autism, right? That's a huge deal, right? I do not go out and slap the pharmaceutical companies in the face. I do not slap the doctors in the face. I do not expose myself to saying that they're doing anything wrong. I might admit that they have misinformation, and they might suggest that I have the same, but we're all working for the same goal, right? But I'm measured by my success, right? I've posted over 1,300 parent responses, almost 1,400 now, to the success of ByoNetics that's reported by parents. The average is 3. If you go to a doctor and say, could you post your successes on the internet so we can have a view of them, the parent responses, they would never do that because they would believe that's not professional. But they choose to pass judgment on individuals like myself because I'm not a doctor. In their mind, if I'm not a doctor, then I have no value as far as information is concerned. But we know in autism that's exactly the opposite. So people have also asked, what is this tattoo on the top of my head that in Buddhism it's called, in Taoism, Buddhism, it's called the blue star of creation. Energy comes in through the top of the head. That symbol can pattern that energy, and you can use it to focus, mentally focus on physical tasks. By having grand mal seizures and having over 3,000 near-death experiences by the time I was 2 years old, because of it, I had a permanent pathway to the other side. Taoism, which is the father of Buddhism, basically, they're very interested in what happens on the other side. And so for over 30 years, and my education is continual, I was trained to understand the spiritual aspects of what's on the other side and make that information available to people. So that's why I have that tattoo. Whenever I became recognized, that was put up on my head. And it's a great tool to have if you know how to use it. So let me let you go. Hopefully Lisa is looking at this video and understands that legitimacy comes in many ways. I'm willing to be able to post all of my parent responses on the internet and provide information to parents without charging them for it, and to find a way for parents to participate in a way that they can afford. So if anyone wants to talk to me, 1-800-280-2802. If you have any more questions about why my videos are done this way, I might want to respond in some ways. When we had a clinical situation, that clinic cost over $10,000, and we wore white robes, white doctor's coats. We had all the trappings of a research facility because we were, but it cost $10,000, right? Well, we chose to make that more affordable in developing cranial dynamics that allowed a computer engineer a brainwave machine for each of the 7 developmental switches that connect the brain computer to the software, thus repairing those damaged connections, right? And we brought the price down to less than $600, from $10,000 down to $600, less than $600. So if I can keep the cost down by sitting at my desk with my bathroom in the background and a picture of me when my daughter was 11 years old, then I choose to do that. If anybody would like to have me dress differently and provide more of a quote-unquote professional appearance, well, then they would have to provide the funding to allow that to go happen. Take care, guys. Bye-bye.